Red flags raised after reports show San Francisco's public school district partnered with a local hospital to coordinate gender ideology and mental health counseling for school children without parental consent. Here to discuss, Director of Outreach at Parents Defending Education, Erika Sanzi. Good morning, Erika. Thanks for joining us.
Hi, Jan. Thanks for having me.
So your organization, Parents Defending Education, received this information through a Freedom of Information request. Tell us what you found and what led you to file this request. Did a whistleblower let you know this was happening?
No, in this case, it wasn't a whistleblower because we had already seen emails and other documents related to some other children's hospitals, gender clinics, partnering with school districts. Philadelphia comes to mind. We decided that we wanted to take a look at some other ones. And so we just submitted the public records request on our own and did discover that there has been coordination between the San Francisco School District and the gender clinic affiliated with the Children's Hospital at University of San Francisco since, I think, going back to 2018.
And this gender center accepts patients for gender dysphoria, I read, as young as 3 years old, and provides puberty-blocking drugs and cross-sex hormones once the child reaches puberty. So instead of informing parents, the school district is also asking the question, how many times is too many times to call mom about a student's comments? So what was the goal of these trainings?
It seemed like in part the goal was to, to bring staff on board with what is clearly an ideology. So, for example, in the trainings, it taught staff that you don't know the gender of a child when they're born, that it's something that the child chooses. And that would just be, again, one example of what they're calling myths. So I think that was part of it. The other thing was that some members of the district, social workers in particular, they had some situations and case studies, I guess, based on real life students that they wanted to role play or discuss with some of these gender clinicians. And what jumped out to me especially was that essentially, if parents don't agree or aren't on board with this gender ideology or with their child deciding that they're going to go by a different name or change their pronouns, maybe even more than once, that it was the parent that was presented as the problem, right? How many more times should we contact them to help them understand? And so I think that's something that we're seeing across the board, this assumption that if a parent doesn't agree, the parent is automatically wrong and just has to be convinced or needs to do the work to learn that gender-affirming care is something that they must support.
And Erika, interestingly, as I was reading this report, I read here that it was documented that hospital staff asked a school district staff member how the school district's counselors are permitted to see kids without parental consent for mental health treatment. Can you talk a little bit about that, what parental rights are here, and why the district would not want parents involved in these matters?
Yeah, I was confused by that, and I hope we can get more detail. But you're right. It did talk about, schools being able to get students into some sort of mental health counseling without their parents' knowledge. And all I'll say about that is, again, schools seem to be forgetting that the only reason that they have authority over children is because the parents have delegated that authority, right? We say that schools have custodial care of children. They serve in loco parentis. It's the reason why I have to sign a form before my kids can take a Tylenol or an Advil at school. Right. So I think the schools are really making a big mistake here, not only, in terms of just what I would say morally here, but also legally. They are crossing the line, especially on an issue that is obviously not only so related to a family's values, but also, incredibly important because this is the identity of their child. And what we're seeing in so many cases is that when the school counselors are gone or the school is gone and everybody's gone and forgets the kid's name, it's the parents that are there holding their hand, helping them pick up the pieces.
Exactly. And as you mentioned before, if there is a danger to that child, period, that's another matter altogether that should be reported and documented anyway. So why wouldn't the school want parents involved, I think, is the bigger question there also. So were there any public meetings with parents, the school district, and the hospital to discuss these trainings? And what are the parents' reactions upon hearing about this?
Yeah, that was a red flag for us, too, because all of this was happening over email in a very informal way, and there was no evidence of any public meetings or any notification of the public at large or of the parents. So again, at least if they had discussed this at a public meeting, and if they have, we certainly haven't heard about it. But from what we've seen, this seems very sort of informally coordinated through email, and therefore it escaped the public scrutiny that would have come with something that was on an agenda at a public meeting. So it's hard not to assume that they were trying to hide something from the public by doing it this way.
Parents Defending Education Director of Outreach, Erika Sanzi, always a pleasure to talk to you. Thanks for joining us this morning. We appreciate it.
Thanks, Jan.